Okay, hello. This is Linda Downey, and I'm going to talk tonight about a deeper conversation about stress, your health, not only your physical health, but your mental and emotional health, the impact of stress on that, and what heart coherence actually means. So hopefully, if you're joining me in the next couple of minutes, we can connect. I would love for you to say hello and where you're listening from. This conversation I did this morning in my coffee chat. A little bit, like just kind of touched on it to get people aware. I actually saw that it was Stress Awareness Month, and I thought, oh, that's a really good thing to point out, that stress is that important to pay attention to. And really, here's why. So I want to, hi, Sergio, from Mexico. Thank you for saying hello. So Sergio just reminded me, this is playing in multiple places, 6 different places. So I may not see your comments in the moment. I'm going to have to go back later and check. Hi from Seattle. Thank you for listening in. So I will definitely go back and look. But if you have any questions about this, I'm going to be bringing some slides up so that you can see more about what I'm talking about. And if you have any questions, either now live or later if you're watching the replay, I'll make sure I get back to you. Okay, so again, my name is Linda Downey. I am a transformational health coach. I work with people in the area of stress, their nervous system, rewiring patterns in their life and from their past so that they can create their life the way they'd like to. And when we're stuck in stress, it's very difficult to do that because you're stuck in a stress pattern, right? So let's dive right in. Let me pull up this slideshow. So while I'm looking at the slides, I won't be able to see any questions, but I will go back and check, okay? Because my screen sees all of this. So HeartMath, if you listen to this morning's conversation, HeartMath is an institute. It's actually a research institute in California that's been doing research on stress for 60 or 70 years. And really, we have the technology now to actually see more energetically about the heart and the heart's role and how the heart really dictates what's going on in our body. So the heart and the brain communicate and work together. I don't know about you, but I always thought the brain did it all, right? The brain was the thing, but actually the heart gives the brain much more information. And let's look a little bit deeper into that. So there's a communication system between the heart and the brain. And what they call actually is the heart has its own brain. So it's called the heart brain. And that communication system within the heart, there's all of its own neural pathways, a lot of its own neurology. And those neural signals going back up to the brain help the brain in perceiving things, what's going on around you, your emotional experience. And we're going to talk a lot about this as we look at the different issues that can show up when our emotions are dysregulated and when our heart is not in coherence. Okay, so let's dive into that. So this slide, if you can read it, says who may benefit from heart rate variability training, HRV. HRV is the gold standard right now in looking at your health and as a predictor of your health going forward. So heart rate variability is the ability of your heart to vary, to go into stress and then leave stress. So we don't want the heart to be staying at a stress place. That would be poor heart rate variability. We want it to be able to vary, respond to what's happening in your life, respond to a situation, respond to whatever it needs to, and then go back to its resting baseline. So people who take on heart rate variability training, and I do this with my clients. We do HeartMath tools, we use HeartMath tools, and they practice getting their heart into coherence. But these are the things, so in your physical body and in your mental health, these are the things that research has shown will improve when you do this type of practice and when you would address your stress by looking at your heart rate. So if you have high blood pressure, cardiovascular disease, that's maybe not that surprising because it's related to your heart specifically. Obesity, if you hold on to weight, there's also studies have proven there's an emotional component to holding on to weight if you're doing all the things and you can't shed the weight. So obesity is really improved. Chronic pain, and that was something that I spoke about this morning. And yesterday, if you follow me, yesterday, Sunday, April 14th, I shared a video with a conversation with a friend of mine and a colleague, Dr. Amy Novotny, who works with people in chronic pain. She's a doctor of physical therapy, and she works with people through their breath. And heart rate variability training has a breath component to it. So your heart and how you breathe. Okay, inflammatory bowel disease, gut issues, autoimmune disorders, if you've had brain injury, cancer, asthma, and insomnia. So those are the specific physical things that we have seen improve when we address stress and we take on creating a coherent heart, which you'll see what that is in a moment. Here's the mental health things. So if you're relating to any of these, I really want you to pay attention to this conversation, okay? Depression, anxiety, PTSD from anything. I had PTSD from 15 years of going back and forth to the hospital with my daughter. That was a traumatic, long-standing, chronic event in my life. And when it was over and done with, I absolutely had PTSD and had to deal with the remnants of that in my body. So PTSD doesn't mean you have to have been in a war. You could have gone through a divorce. You could have been through a lot of different things and a huge financial change and have that. It's just the trauma, the impact of that stays in your body. Obsessive compulsive disorder. If you're stuck with anger, maybe you show it outwardly, you're very aggressive, people walk on eggshells around you, or maybe you don't show it outwardly so much, but you know that you hold a lot of anger in your body. If you have different tics in your body, Tourette syndrome is one, but people have different tics, facial tics, movements that they do. That's a nervous system, how do I want to say it? A nervous system presentation that the nervous system is stressed. Bipolar, grief and loss, if you've had any sort of grief and loss, ADHD, and drug and alcohol issues. So the research from HeartMath, and HeartMath also works with some of the leading universities, specifically, I think, University of California, because they're there in close proximity. They share a lot of research and data with each other. But the research is definitely showing these specific things benefit from what we're talking about. So here's what I want you to know. And these slides are from actually my training as a HeartMath practitioner when I was getting certified. This was part of our course. So that's my instructor up there in the corner, which is why I said that. But heart rate variability incoherence. So when somebody's incoherent, they're upset, they're talking, they're all over the place, right? That's what it would look like. They start their sentence, they don't finish, they're on to another sentence. It's all over the place. This is what a heart rate pattern looks like when a heart is incoherent, stuck in incoherence. The dog is going to be incoherent in a minute. Okay, so what are the things that put the heart into an incoherent pattern? Frustration, irritation, anxiety, and worry. When you are stuck in those emotions, the heart is stuck in some sort of pattern that looks like this. And when the heart is incoherent, it's sending an incoherent message to your brain. So the brain, and yes, there's a part of the brain that's also incoherent, but the communication between the two is not happening. When we teach the body and the nervous system and we practice getting the heart back into coherence, this is what the pattern will look like. It's rhythmic, it's predictable, it's even, and you're feeling things like positive emotions, appreciation, love, your gratitude. So when you're in that state, the brain function changes for the better. You can problem solve, you can communicate with people in your household, at work, wherever you need to. Okay. Let me go to the next one. I'm going to do a couple of more slides and then I'll go back and check to see if there's any questions and then we'll finish up. There's about 10 or 11 slides, I think. Okay, so transforming stress. This is what we need to do. This is the work that we do on getting your body regulated. We have to look at how you relate to stress, the things that are happening in your life. So I don't know about you, but for me, before I learned all of this, I really related to stress is out there, it's happening to me, and I'm oftentimes holding on for dear life, right? That was my perception of it. This line right here is what, if you can read this, it says, it is not the event or the situation that creates the stress. It is how we emotionally respond to a stressful event that has a powerful impact on mind, body, and spirit. It's not what happens, it's how we emotionally respond. And how we emotionally respond has a lot to do with our identity, how we see ourselves, how we relate to our life, how we relate to the world. All of that is part of the rewiring in how you think. But the emotions that you're feeling are a result of your perception, not the event. And when you can get that, you get so much power back in your life. Because when you're thinking it's the event, well, I can't help that. I can't help that my daughter's in the hospital. I can't help that there's been a divorce. I can't help that there's financial issues. I can't help that my child is struggling in school. Whatever it is, when you shift to, I have all the power here to change how I relate to that and to learn how to regulate my body. Now those health issues that were at the beginning that we saw if you're popping in late, you want to go back and see the beginning, because we had a very specific list of what research shows is contributory, a huge part, from stress in the body. So how do we regulate that? Let's keep looking. I'll do one more slide. We're talking about self-regulation. And self-regulation, this is what it is. It's the ability to calm yourself down when you're upset and lift yourself up when you're down. Do you have the ability? So it doesn't mean you don't ever get angry. It doesn't mean there's not something to worry about, but it means you in the present situation, when you're noticing it, you're conscious of, oh, this is where I am. I'm in this place of anger. I'm in this place of anxiety or worry, and I'm going to do what it takes to regulate myself so that I can respond appropriately rather than responding in a way that later on I'm going to regret, in a way that later on I've caused damage to our relationship because I was inappropriate with my anger, or I didn't give you a fair chance to even understand what I was upset about. I expected you to know because you're my partner. Have you ever had that thought? You should know. So things like that. When you're doing that, you're not practicing self-regulation. You want to be able to calm yourself down. Maybe I'll come back and we'll revisit this in a little bit or tomorrow or whatever, but I'm too upset right now. And then you do what it takes to regulate your emotions and your nervous system. Okay, I want this slide, and then I'll go back and check for questions. So if you have anything, put them in right now so I can address them while we're live. So emotional regulation is understanding how your nervous system works. So this ANS stands for autonomic nervous system. Autonomic means automatic. It's there, it happens. We don't, we don't have a lot of control about it until we start to practice control, but it's an automatic system in our body. The stress system, the stress branch of the system is called the sympathetic nervous system. And when we're calm and relaxed and peaceful, it's the parasympathetic. So whichever part of your nervous system is working depends on where you're at and what you're feeling. And we want to work on to create heart coherence, that beautiful rhythm that is, a consistent and expecting. You can see the pattern and know that it's going to continue that way. When we are working on creating that, so we can get out of anxiety and depression and improve bipolar symptoms, ADHD, autoimmunity. Those are all the things that improve with what I'm talking about, okay? What we're working on is lowering your sympathetic nervous system, this one right here, that is clicked on when you're under stress, lowering that arousal, lowering that response, getting it to turn down so that you can have a more coherent heart and better heart-brain communication. When you're doing that, you're able to recharge your batteries, right? You stop feeling so drained. You stop staying in depleting emotions like anger and grief and loss and sadness. You can increase your capacity, enhance your self-regulatory ability, build resistance. Okay, let me see how I can exit full screen and see if there's any questions. Here we go. Okay, no questions. Oh, there are questions. Hold on one second. Okay. So Sergio says, before we thought the brain was in charge, but now we know the heart plate. Yes, thank you, Sergio. Sergio was just reiterating. Let me see if there's anything else. What I was saying, at least that's how, when I went through school, that's how I really understood it. And actually, I was in school quite a while ago, so it's been a few decades. So probably this information was not available when someone my age was in school. I don't know what they're teaching now, but I hope they're teaching more about the heart and heart coherence. Because if we can teach younger people, if we can, especially in today's world, if we can teach kids how to self-regulate and not to just keep perpetuating patterns and behaviors that they've seen in their family, and teach them how to manage their body and get themselves into heart coherence, that would be huge. Because this isn't really part of this conversation, but our kids, we're seeing cancer show up earlier and earlier in people. And I just saw, because of Princess Kate's announcement recently about her cancer diagnosis, I was seeing a lot in the functional health space, where I pay a lot of attention to, about the instances of cancer in younger and younger people. Now, there's a lot of reasons for that. We have more toxic chemicals and things in our environment. We have more processed foods. People are eating more processed foods. There's lots of reasons why that would happen. But whatever the stress is, here's what you should really understand. Stress, one doctor, Dr. Doris Rapp, who's now passed away, she was a pediatrician, and she talked about stress. Imagine like a barrel, right? So you're born and you have this barrel that can hold things, and things keep going in and things keep going in as your life goes on. That's your stress. When the barrel gets filled up to the top, now the next thing that's going to pile on, that's going to be the thing that's going to trigger the cancer. That's going to be the thing that's going to trigger the autoimmune. That's going to have the genes be triggered into the on position if you carry the gene. Or that's going to be the thing that now we can't clear the toxins and the chemicals because the barrel's filled up. If you're not emptying that barrel out throughout your life, in childhood, teaching children how to regulate, then the stress of anger and sadness and grief and loss and all of that is staying in the barrel, staying in the barrel, staying in the barrel. And then at some point, whether you're 20 or 30 or 40 or 60, the barrel's full. And now we're going to see the ramifications. Either it's anxiety and worry, or it's the health issues, or the gut issues, migraine headaches. It's going to be one of those. But if you learn how to empty out your barrel and regulate yourself and get your heart into coherence, now the whole system, that barrel is going to keep having space, because life is going to keep bringing stuff, right? So we can teach our kids that. I think it's critical and interesting to notice that, we're seeing cancer in younger people. So this slide, and it got cut off a little bit, but this is telling us that the same thoughts that we think over and over create the same emotions, create the same attitudes and behaviors. So when you think a thought, there's an electrical impulse. It's not just invisible, or it is, I guess it is invisible, but with certain technology, they can see the electricity travel through the brain. Parts of the brain light up. Once you have that thought a couple of times, you're now hardwiring particular neural pathways. You're actually creating like sidewalks to go down. And if those thoughts are things like, life is too hard for me, this isn't fair, I don't have enough, nobody cares about me, if it's those kinds of thoughts, that's going to create particular emotions, which is going to create particular attitudes, right? If you think nobody cares about you, you're going to be a certain way when you're around other people. So whether your neural pathways are healthy or unhealthy, whether you're practicing those things in your life, depends on how your thoughts have been hardwired. Now, here's the good news. You can rewire them. It's kind of like, this is how I imagine it, getting a virus on your computer. Once you realize it, you may have to take it to, the store so that they can get the virus clean, or take it to a computer expert. But it doesn't mean the computer's bad. It means there's a virus that's been downloaded that's causing things to not work right. You're trying to do something that the computer normally can do, and it won't do it because the virus is in the way. Same thing with our body. Once you realize I've hardwired certain ways of thinking that have had me be stuck in emotions and attitudes, and here's the thing, if you're not ready to be self-reflective and to look at what are my patterns, it's totally fine. It means you're just in a place of still relating to, it's all out there and I don't have any control. You have to be ready to be self-reflective and say, what are my patterns that I have hardwired, either through my family and the way that I had experiences, or my own life, whatever it is. And now I have these behaviors and patterns that are not serving me, that are keeping me stuck. When you can do that, then you can start to rewire. And there's very specific ways that we do that. But this, so what this says here is the patterns can be thought of as a baseline or a set point that your brain wants to go to over and over again. It's like, it's just familiar. Did you ever drive a car and you go the same way every day? So you get to your destination, you're like, well, I don't even remember driving here. You didn't even have to pay attention because you were so used to it. You could be, singing music, talking on your Bluetooth with somebody, you're talking to somebody in the car, and you're not even paying attention. You're just making all the turns, and then all of a sudden you're there. That is very similar to what happens in the brain. It just automatically goes there. Okay. So this is our last slide. What I want you to see, and this is a great chart. I use this as part of the work with my clients, but I wanted to share this with you. When we put together a plan, and they're working on their heart math and their heart coherence. This chart looks at, on the left-hand side, these are the emotions that are depleting for me. And on the right-hand side, these are emotions that restore me. No emotions are good or bad. We start off just actually getting used to that. It's not a bad emotion or a negative emotion. It's just an emotion that's going to deplete me. It's going to fill up my barrel and then make me be at risk for issues, or it's an emotion that's going to restore me. So first there's that, right? And we have this divided right down the middle. And then also at the top, these are high energy. So on the left, emotions that deplete me that are high energy, which is anger and anxiety, right? Like when you're anxious, you can't sit down, you can't go to sleep. Anger has a lot of energy to it. But if we go down, still on the left side, we're still in the realm of emotions that deplete me. But now when we go down, it's lower energy. So it's sadness. The energy of sadness is very different than the energy of anger, right? Anger has much more to it. Sometimes just getting someone from sadness to anger is a good thing because now they're in action, right? There's a fire in anger, that when somebody's stuck down in sadness or apathy, they don't care. It's just a low energy. On the right-hand side, when we talk about the emotions that renew us, up at the top, happiness, excitement, right? There's a lot of energy there. When you're happy, you want to skip down the street, you put some music on and you're dancing, you want to laugh easily, all of the things, right? So there's a lot of energy there. You can have renewing emotions that are low energy, like you're just feeling contented, you're just peaceful, you're maybe sitting somewhere enjoying nature and it's calm and it's peaceful and you're happy. It's good, but it's not like, high energy. So it's not that either the high energy or the low energy are good or bad. It's just a place to look. Where do you fall? And on the left-hand side is cortisol. So when your body's pumping out cortisol, because you're in these emotions, you're staying stuck in frustration and resentment or anger and anxiety or sadness. All of those, in terms of how the body sees it, are a problem that need to be solved. They have you stuck in fight, flight, or freeze. And that's going to affect all of the systems of your body. The other side, when you're feeling happy, your body is pumping out DHEA, which is a different hormone. And it's a hormone that is anti-aging. So when people are aging, we see DHEA drop. If you want to address aging, just kind of separate from this conversation, but just even from like, oh, that's actually cool. I wouldn't mind helping my body through the aging process and slowing it down. You want to produce more DHEA. Well, the way to do that is to practice emotional regulation and get your emotions in this side, on the right-hand side, in the renewal side. Love, appreciation, contentment, peace, happiness. When you're in those emotions, the biochemistry of your body is producing the hormone DHEA. Now you have that hormone for fighting aging things, cleaning up cells that have been damaged or waste in the cells, things like that. Okay, I'm going to leave this screen. Okay. And let me remove the slide. There we go. Okay, so some people did. So have you tried microdosing? Okay, so somebody's in here marketing mushrooms. Microdosing is what they're talking about. Somebody's in here doing that. And then somebody else said, I need a replay. Yeah, absolutely. This will be on here. As soon as we're done, you can click and you can watch this all again. If you have any questions, because of my autoimmune conditions, which started out as a gut problem in my 20s, ulcerative colitis, and then multiple things after that, and a lot of stress in my life. This is the journey in my life that had me come to where this is the work that I do with people. I had to do the work first on myself, and it took me years. I would love to have it not take you years, because that's your life. You don't get those years back. And so I'm now trained in doing this kind of work. So please drop me a comment if you want to connect, and the replay will be here, and I will make sure I check back later and tomorrow to see any of the comments that you might have. Or if you comment and I don't get back to you, it's because I didn't see the comment. You know how Facebook can be. So send me a direct message if you need to do that, if you're really interested in doing that. Okay, so thank you so much. I hope that was helpful, understanding heart coherence, what it helps, why it helps, and then the how is a much bigger process. Okay, thank you so much. Have a great night.